Well, quietly over the summer, the Quebec government announced plans to restructure a provincial access committee, which for decades has been monitoring and providing suggestions on where and how and when English-speaking Quebecers are offered services. Some of the changes include having the health minister control the final appointment of new members, and a government employee will be in charge of communications. And in Montreal, where most Anglophones reside in the province, they'll have 2 members instead of 3 or 4 on this committee. The Quebec Community Groups Network is ringing some alarm bells over these changes, and we're joined now by Eric Maldoff. He's chair of the QCGN's Health and Social Services Committee. Eric, welcome back to the program.
Nice to be with you. Thank you.
Eric, first off, how did you find out about this? Because we hear it was done quietly. How did you find out these changes were in the works?
The government simply went ahead and published draft amendments to the regulation governing the Provincial Committee on Access to Health and Social Services in the English language. They published it in the Quebec Official Gazette. As you know, every Quebecer reads that religiously. On the 30th of June, as you know, every Quebecer is sitting around waiting for the Quebec Official Gazette on the 30th of June. And it came to our attention when the chair of the Provincial Access Committee forwarded me a copy a couple of days later after it had come to her attention.
And in a nutshell, what are the changes that you're so concerned about?
Well, essentially, this committee plays an important role, and it's a bit complex, and I'll try to make it as easy as possible to understand. Right off the top, the right to health and social services is written into the Quebec Health and Social Service Act. It was first enacted in 1986, and it said that English-speaking persons have a right to health and social services in the English language to the extent that those services are identified and set out in access programs which the regional health authority of every health region of the province must prepare. And those access programs are to be reviewed by a regional access committee in each region and comments given to the regional health authority. And from there, they go to the provincial access committee, who in law exists under the Health and Social Services Act, and their mandate is to make recommendations to the minister concerning the draft access programs and whether they ought to be approved or modified. So they play a very important role as the eyes, ears, and brains of the community in terms of our right to access to health and social services. If it's not in an access program, we have no right to that service.
And so how do these changes that are being proposed, how do they hinder that mission?
Okay. So after Bill 10, the restructuring of the health and social services legislation, the network took place under Mr. Barrett in 2015, and I was directly involved in negotiating amendments to that law to secure our institution and strengthen the right to access to health and social services. We approached the minister and said, given the completely new context, we need to do a major review of the regulation governing that committee. And we need a regulation that's going to ensure that the people on that committee are connected to the community, have knowledge, and a real knowledge of the health and social services system and health and social services, and that they have a mandate to communicate and consult with the community, because otherwise they can't do their job without that. It was to be a committee appointed or from the community, by the community, for the community. And we got that into the regulation. Community organizations identified the people who should be appointed by the minister. The minister appointed from a list proposed by community organizations. The committee chooses its own chair and vice chair. The committee was mandated to communicate and consult with the community. The community chose its chair and vice chair, as I've said. and controlled its communications, or was supposed to control its communications. What does this regulation do? Henceforth, from now on, the minister will be in total control of the appointment process. He appoints a selection committee of his choosing. The selection committee puts forward names to the minister, not to be necessarily appointed. They vet these people. The minister then is free to choose whoever he wants to put on that committee. The communications have been restricted to the secretary, who is a government official. The secretary of the committee has been put in charge of all communications. The minister establishes a communications policy. The minister will appoint the chair and vice chair of the committee. The committee is not allowed to consult except with the permission of the minister. That's about the picture that we're getting. So this is a committee that will be completely controlled and silenced by the government.
We're with Eric Maldoff from the Quebec Community Groups Network, talking about some proposed changes to a provincial access committee on health care, and in particular English-speaking health care for English-speaking Quebecers. Now, Eric, Christopher Skeet, who's the parliamentary secretary for Anglophone affairs in the CAQ government, says that the changes are to make the committee more representative, to give some more voices for Anglos outside of Montreal. What do you say to that?
There was a long discussion when we negotiated the regulation with Mr. Barrett and the minister back in 2018 when it came into effect. Mr. Skeet says that to give more representation of the regions, he mentions in particular Laval, Montérégie, Eastern Townships. They already explicitly are given seats on this committee, and this regulation does not change that. Where there is a change is they're suggesting that one of the seats of the 11 seats on that committee should be someone from an Indigenous community. And beyond that, they take one seat away from the Montreal region and give it to the small regions. Let's be clear. Montreal represents more than 50% of the English-speaking population of Quebec. And with the adjacent regions, services even a larger portion of the English-speaking community. Two representatives from Montreal makes no sense whatsoever. And in light of the experience with COVID, it's all the more evident. With the diversity that exists in Montreal, the ministry missed it completely at the beginning of the COVID epidemic. And now we look at specific situations with the aged and different parts of the diversity of our community that need service. Two people are going to cover them. How are we going to decide what they represent? Men and women, tall and short? I have no idea how that's going to work or why that's appropriate.
One last question for you, Mr. Maldoff, and it has to do with the fight against Bill 96. Do you see this as just another salvo in that brewing fight on language issues and Bill 96? Do you think it's all tied together?
If you'll bear with me a moment on that, this is a really important question.
I got a minute for you. I can only give you a minute, no more.
Okay, I'll be very quick. This is about health and social services. This is about safety and quality of care. Communication is essential to quality care. Imagine trying to serve an elderly person in a home for the aged and not be able to communicate with them because they don't have facility in a second language or whatever, or people showing up in emergency, or the need to give informed consent, or the ability to understand instructions post-operative given by a surgeon. All of that stuff depends entirely. And when we got this right written into the law, it reflected the fact that for all of Quebec's history, we have recognized the need for sensitivity and capacity to deal with language and cultural matters. And that explains the Chinese Hospital, the Institut Polonais, Santa Cabrini, Royal Victoria Hospital, Jewish General Hospital, Montreal Children's Hospital, Montreal General Hospital, etc. All of them predate the right to health and social service. The last thing to say, the right is written in favor of English-speaking persons in recognition of the fact that when people need health and social services, it's vital that they feel comfortable in receiving and communicating in a language that is one in which they are capable or feel at ease. So it's not English mother tongue. It's not English went to English school. It's people who are English speaking. So this is a question of quality and safety. Is it related to Bill 96? Well, the coincidence may be quite something, because this committee, by virtue of this regulation, will cease to exist the day that the government brings the regulation into effect. And from then on, there will be no committee until the government names its own hand-picked committee, whenever that is. The committee has a mandate right now to speak on any amendments to legislation that can affect the community, and this community will be silenced on 96.
Eric, I have to leave it there. I want to thank you for bringing that passion to the program this morning. I appreciate it.
Thank you for listening to me, and thank you for the invitation.
Eric Maldoff is chair of the QCGN's Health and Social Services Committee.